Alright, so today I'm working with my patient, Kelly Boyd. I've already introduced myself to her, and we've already done our positive patient identification, so I know that she is who she says she is based on her first and last name and her date of birth. So today I'm going to be changing the cap on her CVAD. She's got a single lumen CVAD in right now, and I, for the purposes of this video, am using an IV for this. So I'm going to be doing a cap change, I'm going to be flushing it, and I will be doing a heparin lock because it's a non-valved CVAD that I'm using. And I'm also going to be doing a dressing change. So to begin, I'm going to wash my hands. And the reason that I'm changing the cap is because we drew some blood and there's blood in the cap, and so it needs to be changed. So I've done my hand hygiene. I'm going to put on some clean gloves for the cap change. First thing I'm going to do is I'm going to prepare the new cap. These gloves are too small for me. I'm going to prepare the new cap on a new normal saline, and I want to make sure I get out all the air because I don't want to cause an air embolism in my patient. So I'm going to open up a new cap, being careful not to touch the sterile ends, the access port and the other side. So open up my normal saline, drop back. We want to get the air out of it. Now I'm going to pick this up from the middle and I'm going to attach them. So keeping it sterile to sterile. And again, I'm going to just make sure that I get all the air out of the cap and fill it fully with normal saline. Okay, so that's good and ready to go. I'm just going to put it to the side. Next, what I'm going to be doing is with a new normal saline, I'm going to do a quick flush of my existing cap. So first, I'm going to clean the cap for 15 seconds. And 15 seconds has passed. If I want to put it down, I'm just going to put it on top of that alcohol swab. Keep it sterile. Now I'm going to get rid of the air. Going to attach my new normal saline to the cap. And I'm going to unlock it. First thing I'm going to do is I'm going to draw back, which I'm not going to get anything because this is a binder, but I'm looking for blood to make sure that I've got it in a vein. And good, I see blood, so I'm going to do, and I'm again not going to do this flush because I'm going to get water all over my desk, but I'd be doing push-pause technique for my flush for 10 cc's of normal saline. So push, pause, push, pause, push, pause. On my last push, I'm locking, and then I can unscrew. So that's flushed with normal saline, and I already know that it's in the vein because I pulled back. Next, what I'm going to do is I'm going to clean the cap again. Oops. Pretend I didn't drop that. Clean this cap. Going to remove this cap, and it's all locked off. Going to clean the exposed hub before I put on the new cap. So I'm cleaning the exposed hub for 15 seconds, and 15 seconds has passed. Got my new cap that's all prepared without any air in it. Take off the cover, that plastic white cover, and I'm going to attach this one on. Going to unlock, and I'm going to do my push-pause technique for another 10 cc's. Push, pause, and this is going to be quite aggressive because I really want to make sure I'm cleaning through that catheter. So push, pause, push, pause, push, pause, push, locking, that would have been 10 cc's. Going to take off my normal saline, and like I said, this is a non-valved CVAD, So I need my heparin lock to make sure that we don't get any clots. So cleaning the new cap now for 15 seconds. And if I want to put it down, I put it down on my alcohol swab. Get the heparin, make sure that there's no air in it, just the heparin. Attach. I'm gonna flush this one with 5 milliliters. So unlock. And this one's just gonna be gentle. Gently infusing and locking while I'm pushing. And that's to keep that negative pressure. Okay, so now my cap has been changed. Like I said, this is a single lumen, so I don't need to flush any of the other ones. Cap changed, it's been flushed, it's locked, it's all good to go. Next one, what I'm gonna do is my dressing change. So, take off my gloves, wash my hands. Now, I want to put on a pair of gloves, but it took a minute last time because they were so small. So, let's see how this one goes. So I'm putting on clean gloves for the removal of the old sterile dressing, the old dressing. And then once I've got it all cleaned up, I'm gonna put on, once I've got it exposed, I'm going to open up my sterile dressing tray and put my supplies in, put on my sterile gloves, we'll clean it, and then we'll get the new dressing on. So I've got new gloves on. First thing I'm gonna do is I'm going to take off the old dressing. This is challenging because it's not human skin. And once I take this dressing off, this is gonna slide because it's not in my binder. And when I'm pulling it off, I'm pulling the edges up first, so as to not disturb the catheter and move it to a different location than it should be. Oh, goodness. I'm doing this as gracefully as I can. Oh, I just remembered that I'm supposed to be wearing a mask during this process. So let's pretend I was wearing a mask the whole time I started taking off my dressing. So, remove the dressing, the old dressing, and now I'm taking a look at it, looking for redness, swelling, any signs of infection. Looks good to me. I'm going to measure the length of the catheter that's outside of the body. So I see this one's roughly, that one's 10 centimeters long. So I want to make sure that when I put the new dressing on, the catheter length that's outside the body is also 10 centimeters long. So it looks good. Now it's all exposed. I'm going to get my sterile dressing tray ready. So, and I'm not reaching over the sterile field. Okay. Now I want to add in my cleaning, and I'm using chlorhexidine. If I use chlorhexidine with alcohol, then it could degrade the catheter tubing, so I don't want to do that. So I'm adding these into my sterile field. The reason I'm wearing a mask is because I don't want any fluids to, well, this is sterile. If I were to contaminate, then my patient's at risk for sepsis. So this is so that I don't breathe onto the sterile site. So I've added my cleaning supplies, adding my skin prep. And then finally adding the chlorhexidine dressing into my sterile field. Next, I'm going to be putting on my gloves, my sterile gloves. So, wash my hands. Okay. Okay, now I've got my sterile gloves on. First thing I want to do is I want to clean the site. Now I can touch things in here. So in a zigzag motion, I'm going to be cleaning each side out, flipping it over, starting at the base and working my way out. That's garbage. New one. I'm gonna do top to bottom. Obviously the catheter would be in my patient's body, and so it wouldn't be moving around like that. If I needed to stabilize it, I could just use my gauze so that I don't contaminate my sterile fingers. And I flipped this side to a clean side and I'm going down. Next I'm going to go up the catheter, flipping it over and doing the other side of the catheter. Perfect. So I've cleaned the site. I'm gonna let it dry, and obviously it wouldn't move positions if it were actually in my patient's skin. So let's pretend that this is dry. It's not, because this is plastic, but it would be if this was skin. I'm gonna use my skin prep and I'm gonna just clean around the site so that my dressing sticks. Okay. Got my dressing here. And need to let that dry. Again, it's not going to dry. So, got my dressing here. Oh, and actually, sorry, just before I place this, this hand is no longer going to be sterile. I am measuring from afar, making sure that the length of the catheter is still 10 centimeters, and it is, so that's good. This hand is no longer sterile, so I won't touch anything under with it. You can go on top though. And put the dressing on. Now that this is covered up, neither of my hands need to be sterile. So I can feel free to move around as I need. Take off the sides. Which is challenging to do with gloves on. There we go. So I've got my dressing on. Going to put my label on, the time and date. Put that there. And that's everything. Thank you.